So that's the nurse. Let's bring in Congressman Tim Murphy. He is the chairman of the House Subcommittee on Oversight and Investigations. He is calling for a mandatory 21-day quarantine for any healthcare worker who treats Ebola patients and then returns to the U.S. Congressman, thank you for joining us this morning to test the situation. Do you have the legal right? Federal, no, but state, yes. Is it right to do? That's the question. Why is this the right thing to do when science tells you it is unnecessary?
Well, let's look at what we know and what we don't know. A person who has not been exposed to someone with Ebola, there's virtually no chance you're going to get it. A person who has been exposed to a patient with Ebola increases that risk. Many have gotten sick, many have died, and in several cases not quite clear of the exact route of that. Now, it doesn't mean that a person who is totally asymptomatic has no chance whatsoever of transmitting something. And what has happened here in the last few weeks is the CDC has sent out guidelines that they had to walk back on. Some are confusing regarding exposure risk, the kind of equipment you should be wearing. They said that any hospital could handle this. And still we have a situation where there's no cure, there's no vaccine. And so what governors have responded to is it says, look, this is still ambiguous. There's mixed messages coming out of Washington how to handle this. So their first goal is to make sure they protect the health of residents of their state.
Right.
The other part of this is we're still not ready. Hospitals around the United States, very few, less than a handful, have the ability to treat Ebola patients, and it can overwhelm other hospitals at this point. We also don't have mechanisms to transport Ebola patients through air, et cetera. So because those things are still existing, this issue is still evolving.
Leadership hasn't been great on it. That's probably clear. Why aren't you focusing on your second issue? That one matters. Are hospitals ready? Is there enough oversight? Are you doing the right precautionary measures, testing it, vetting it? I think that's real. I think that's helpful. But when you're dealing with the quarantine, isn't it just pandering that people are afraid? There was political opportunity here to exploit that fear, and now you're dealing with something even though no one in the medical field believes that it's worthwhile, because while you are exposed to Ebola patients and therefore at risk, that's true, but you're dealing about when people are a risk to others. And even this Hickox, she can't get anybody sick like that. Mr. Duncan may rest in peace. Those people who were in the house with him when he was sick as hell, none of them got sick.
Well, what we have to make sure is we're also not dealing with this emotionally. And that's a great question you're asking, Chris. What I believe is the first thing you do while we're still learning and while we still don't have facilities, you start with a stronger perimeter of defense. Then you make case-by-case rulings on this as it goes through. Are we reaching that level? Perhaps, where people can make that determinations. Now, by quarantine, you don't have someone sealed in a plastic bubble and with no contact whatsoever. You can do also a lot of monitoring and some levels of isolations. But you also look at hospitals at this point. They are not, they do not want the doctors and nurses who have recently been in Africa coming back and treating patients in their hospitals right away. So they're doing other kind of job restrictions to go with this too. But again, let's look at these now on a case-by-case basis. Are we ready? Are regions ready? Are states ready? And let's focus on making sure we follow in an area where there still is a great deal of uncertainty.
So why don't you just leave the quarantine issue alone? You know, why is that the headline this morning? I brought you on here to talk about what you want for a 21-day mandatory quarantine. Why not ignore that, seeing how it's not a practical problem in our society right now, but preparedness is. And certainly, given the relative lack of commitment that we and other countries have shown to West Africa, we will see more cases here because we're not stopping it where it is emanating from.
Well, you're asking several things here. First of all, we have a strong commitment to help Africa. Right now, it's also
we need more, though,
with regard to
Congressman. You know we need a lot more.
Absolutely, absolutely. And I believe we're all committed to do that. We should be sending lots of supplies, do everything we can, because that's where it has to be contained. But this virus, you only break the chain of its movement by having some levels of isolation. I'm not focusing only on the quarantine. I sent the president 9 different recommendations. Some of those are already taking place. We still have a long way to go. We're speeding up vaccine research. We are moving forward and trying to identify more hospitals. We're moving forward, but not there yet, with transport mechanisms. But in the meantime, I think one should move with an abundance of safety, like the military is doing that too. Let's be careful as we move forward. You can always walk it back, but you can't rebuild these things once it has spread. This is not any kind of personal or emotional attack on anybody at all. This is saying our first issue is do no harm, protect public health. Let's review each case. That is the CDC is also recommending as well, but in cases before when they said the personal protective gear was fine, that turned out not to be true.
True.
So just because...
True.
So I say we have a lot of intensive work to do in this. We should not let up in any way, and let's review this as it has to do with the spread of a disease.
Worried about the chilling effect that you're going to have on people who would have volunteered and now won't because they don't want to be subject to a quarantine?
Well, look, programs like Samaritan's Purse have had this program in place for a while where you restricted movements for 21 days afterwards. When I've talked to hospitals, they say they don't want that doctor and nurse coming back on board to their medical staff for full active duties for 21 days. The issue with regard to getting enough doctors and nurses into Ebola countries is hard enough in itself, and we need to get more people there and encourage them. But we also have to make sure that this other issue, and doctors and nurses understand this that I talk to, they said, look, we don't want to increase risks to the community. Let's be cautious. Let's have abundance of caution. Let's move on this. But let's not make this an emotional issue that we're being unfair to someone. That's not it at all. We also have to be fair to the citizens of the United States and making sure we're very careful with this. Review each person carefully, individually, see what kind of exposure they've had, but let's not make blanket statements that says all should be allowed until some symptoms appear, or quite frankly, I'm also not saying no one should be allowed, but we should have caution as we proceed.
Congressman Tim Murphy, you know that given the controversy, the job is to test the position. Thank you for allowing us to do that on New Day.
Thank you.